Welcome to the Mental Health Reform Podcast. Here on Mental Health Reform, we believe in starting important conversations, breaking down stigma, and highlighting the incredible work of those who dedicate their lives to making a difference in the mental health space in Ireland. Today's episode brings us into conversation with Shine, one of Ireland's leading voices in supporting people affected by severe mental health conditions, especially psychosis. Shine is a national mental health organisation that works alongside individuals and families, offering hope, advocacy and practical supports rooted in lived experience. And with that, I'm very pleased to welcome Nicola Byrne, CEO of Shine. Nicola, hello.
Thank you. Good to see you, Stephen.
You too. Thanks for joining us. And I'm just noticing it's very fortuitous that we're recording today, as that World Schizophrenia Day will be a couple of days on the 24th of May. How's the month been for you?
It's a very busy month. I think May and September are particularly busy. Although I've noticed that the year doesn't seem to have any bit of respite in it these days, and there's a lot of demand on services. But it's great to have opportunities to have conversations about important issues that can make a real difference in people's lives. And May is important to start that conversation. And then in September, we Green Ribbon Month, where we come back to the issue again.
And May was also the month that you launched the psychosis survey results.
Yes.
Okay.
Yes.
Do you want to speak about that?
Probably important for me to just talk about, first of all, what is psychosis?
Yeah.
And because there's a lot of misinformation out there about psychosis. And I'm very fortunate that I'm the CEO of an organization that's been going since the 1970s. And, when it started up originally, it was known as Schizophrenia Ireland. And so a lot of people that we work with experience psychosis. So psychosis is a mental health condition that affects how a person perceives and interprets reality. And during an episode of psychosis, the person might experience delusions, and they're like strong beliefs that are not based in reality. It can be thinking that someone's out to harm them without evidence. Also, they can experience hallucinations, which you can see things, hear things, or feel things that aren't actually there. Most commonly, people hear voices. Other things that people may experience include disorganized thinking or speech. So you can have difficulty concentrating, following a conversation, or expressing thoughts clearly, or changes in behavior. You may appear withdrawn, agitated, or behaving in ways that seem out of character and difficult to understand. Psychosis is not the same as being dangerous or a split personality. They're harmful myths that are out there. In reality, people experiencing psychosis are far more likely to be frightened or confused than to pose any risk, and at risk to themselves or risk to others. Psychosis can be a one-off episode, part of a condition like schizophrenia, bipolar disorder, or severe depression, or triggered by a stress trauma or substance abuse or physical illness. It was deeply moving to see how often people mention peer support and community as lifelines. One parent shared how connecting with others helped them support their daughter to build a relationship with her voices. That kind of insight doesn't come from textbooks. It comes from lived experience, and it's powerful. What's also upsetting is how many people described feeling invisible or judged, especially by the media or when accessing services through A&E. We read stories of people waiting in hospital corridors during a crisis or feeling written off by systems that didn't take the time to understand their reality. But within all of that, there is hope. People want to recover, to connect, to work, and to be understood. They just need the right support.
And I think the feedback on the survey, there was an increase of 28% in participation the last year compared to the year previously. So there's definitely a need and a want from the community to be able to express their own opinions.
And this is our third year doing that survey. And each year the response grows. We use a lot of social media to get out to people and access people, because most people use social media now for information and interact with. So it is an important arena that we have to work in.
And what were the main themes of the survey's results?
I think there was a number of important issues that were raised, and for us, the first one was really around the need for expansion of the early intervention and psychosis services, and we need to scale up EIP teams as we know them across the country. They have the importance of the use of critical and comprehensive care plans, and the fact that people who experienced EIP were able to talk more about having a key worker. It was clearer for them in the system. Also, accessing interventions that made a difference, such as CBT, that was psychosis specific, and family therapy, that was understood in the context of psychosis, integrated physical health approaches, and employment support. Another thing that's important is we need increased funding and staffing. We need adequate investment in mental health services. We need to reduce waiting times for assessments and interventions. We need actual access across rural and urban areas, and an understanding that services delivered cannot be a one size fits all. The third area that we said that we found in the survey was the importance of combating stigma through public education. And in China, that's a particularly important issue for us. And it's a pity, but it's a fact that we still have a lot of stigma around mental illness, especially illnesses like psychosis. So there is a need for more investment in collaborative campaigns between healthcare, schools, and media outlets. So we can do this through educate public on the realities of psychosis, highlighting recovery success stories, and getting rid of myths and stereotypes. Another area that we found was important in the survey was the importance to establish crisis support outside of hospital. Hospital is no place when you're experiencing this kind of an issue. And so it's important to develop crisis supports where people with specialised care can be seen in a less intimidating environment, and that we prevent delays in treatment during this time. We also found that there's a need to strengthen community-based organisations like ourselves, and there was many other organisations mentioned in the survey. So community organisations need increased funding and secure funding so they can expand their reach and programme offerings and support family members and caregivers alongside individuals. Shine is quite unusual in that it was set up by a group of family members in the 1970s. So we see family members or supporters. We tend to call use the phrase supporters now because you don't have to be biologically related to someone to be considered their family. And that role is really, really important. The last two areas that the survey really recognised as key areas is the need to integrate addiction and mental health services, that integrated models address co-occurring conditions and ensure comprehensive treatment, and also racial continuity of care. And finally, there is a need. People exist in their communities, and your mental health is impacted by your occupation and also by your living circumstances. So there's a need to enhance housing and employment support, and there needs to be better collaboration between housing services, employers, and we need to stabilise living conditions for people who experience psychosis and foster inclusive work environments.
I guess going back to the start, what comes to mind is just the looking at the data, like the transformative nature of EIP compared to standard care. Like the numbers were quite stark. How is this not a a thing now?
I think, for me, the numbers are there and the numbers are clear. The evidence is there. You and even we've had this work analysed from an economic perspective. And, for every euro invested in psychosis services, a multiplier comes back into the economy. So it's a really worthwhile investment. But I always say in a system that is very much where the political lifespan is, a matter of years. But the most important thing is how do we get people to be politically active? And I'll never be able to fill the Dáil viewing gallery at the moment with people that are able and feel comfortable to stand up to say that they've experienced psychosis. And I think that that's the difference. Unless we have a way of articulating the issue and people standing up and saying, this is impacting me and we need investment in it, it's never going to be a really important political issue. About 1 in 100 people experience psychosis in this country. That means that most people know someone who's experienced psychosis or schizophrenia. But the difference is often people might choose to describe it differently, or, they might use a different label because it's not as socially acceptable.
It seems almost like a chicken and the egg scenario. If there was a destigmatization of psychosis, then people would be more prepared to stand up, like to address that chicken and the egg. Like the media has a responsibility here. Why do you think that idea of psychosis is still rooted in fear in the media portrayals that we see?
I think there's a number of layers to this, and it goes back to me saying to you that it's important that we understand what psychosis is. And there's a lot of myths out there. Shining Paths, a media program, was formerly known as Headline. And for more than a decade, we've worked with journalists in this country around, and we've been using the guidance from the Samaritans around reporting about mental illness and suicide. And we have found journalists and broadcasters in this country to be really, really keen to do good by the public. And we've had huge improvements in how items and issues are being reported on in a less stigmatized way. We know all the evidence points to that if you get the voice of someone with lived experience talking about issues, that makes a real difference. The issue in the media is more to do with fictional media. So our program doesn't monitor fictional media, soap operas, and the influence of media from other countries. We have no input or insight into that.
And maybe giving ownership to the viewers to fact check these sources as well for themselves.
Yeah, and unfortunately, there's not a lot of fact checking that can go on, and there's a lot of misinformation on the internet. So it's very hard, especially when you see stories in the media that don't make sense, and it's very hard because they're then not only is the public getting the wrong information, but somebody who experiences this label may find themselves feel embarrassed, want to socially withdrawn, less likely to be open about their own needs and challenges.
And all the while, then that experience has been exacerbated in isolation and seclusion. How do you want to bring these people out into the light?
There's a number of different ways we can look at this. One of the things is that we need the government to show leadership in actually saying psychosis is an important issue in this country. This survey really showed that currently we have a two-tier system. And if you're lucky enough to access an EIP team, then your chance of getting the right support, like a key worker or family involvement by the multidisciplinary team or psychosis specific therapy are much higher. But the majority of people are still going through general services where access is harder, recovery planning is patchy, and supports can be inconsistent or completely absent. And that means that sometimes people fail because their families aren't getting the support they need to truly understand and deliver the support network that's needed by the person experiencing this very stressful. That when you go through a psychotic episode, it can be very stressful. So we need to get rid. It's more than a postcode lottery going on at the moment. There's a structural inequality in the mental health system, and it's quite unfair. Psychosis is not a rare condition, and everyone should have the same right to access person-centered recovery focused care, regardless of where they live or how they enter the system. From our perspective, we need, to support the expansion of EIP services and ensure that general services are resourced and trained to deliver a decent quality care. No one should be left behind because the way the system's designed. We need a standard of excellence that's accessible to all. I think that if people saw that they access to good services in a timely way, and that it was something that is part of, just a risk factor, and similar to physical illnesses like cancer and stuff like that, and that good treatment in a timely way makes all the difference.
It would definitely incentivize people to voice up and acknowledge their experience if they knew that there was good treatment available to them.
And we need to look at, we're talking there about the media. And in the survey, it said that 70% of respondees found media portrayals of psychosis inaccurate or harmful. The fact that 70% identified media portrayals as inaccurate tells us something that we can't ignore. That stigma is louder than the facts, and the stories of violence and chaos continue to drown out stories of hope and resilience. Someone who experiences psychosis schizophrenia is much more likely to be the victim of a crime than they are to commit a crime. And yet, when you speak to people in the public, that's not their understanding. Because the rare times they hear about psychosis, they hear about somebody becoming so unwell, maybe being left outside of services or being challenged in accessing services, that they then come into a situation of distress and they do something to act out because they often feel under attack and they can't trust anyone. So, if we're talking about changing people's ideas around psychosis and schizophrenia, we need to do a number of things. We need to platform the real voices of people with lived experience, put them in the centre as experts, as storytellers and change makers. And there was a significant piece of research done a couple of years ago by the Lancet on stigma. And it said the most important way of changing people's understanding and eradicating stigma is actually for people to hear the lived experience of those that are going through this, and that it dispels the myth. Because you realize then that somebody can have this label, but they can also be a mother, they can be your colleague in work, they can be the person that you're talking to at the sideline at a football match, and that people are much more than a label. We need to platform the real voices of people with experience, but we also need to work more with those that are in healthcare, that are, social influencers, people who are working in fictional media. Everyday stories are making the headline that really, really lean into these myths. And so it is important. And our Green Ribbon campaign, which is every September, works towards dispel, and all of the mental health organisations in the country get behind the Green Ribbon, because Green Ribbon actually started out as a consortium of all mental health charities in this country, and it's a national stigma reduction program. So it works to actually challenge people, get people to talk more, because we know one thing: the more open and inclusive our conversations are, the better chance people have of reaching out for help and recovering quicker.
What gives you hope for psychosis care in Ireland?
Okay, well, there's a number of things. Like, this survey does give me hope in that the increased volume of people that were willing to reach out and give their insights is really, really hopeful. The likes of the sharing the vision, the National Mental Health Policy being a 10-year plan and being similar to Sláinte Care is really important, because it moves beyond political cycles. And I can see the implementation of change happening and growth happening. And at the centre of the implementation of our mental health policy, we have quite an unusual thing compared to other countries. We have a group called the Reference Group, which is a group of people with lived experience and family members, and they get to review the reports of the implementation committee, the reports that are given to the implementation committee, and to comment on them. And that's been up and operational 3 years now. Shine acts as the secretariat, so we recruited those people, we provide support to them, and what we found is there's a willingness within policymakers, service planners, all of that, in listening more to what they want and what they need. And there's now an acknowledgement that actually projects and programs are less likely to fail if people are consulted with, included from the start. So it's that nothing about me without me is very important. But I suppose what gives me hope is people. It's that simple. The people who shared their stories in this report, often in the middle of really awful experiences, they still found the time to say, this helped, this matters, this can change. And that's really, really, really good. I see hope in the early intervention teams who are showing what's possible when you meet people early with compassion and skill. And I see it in the families who show up every day when the system doesn't. I see it in our peer facilitators in the work that we do, in support groups, in recovery journeys. But I think we need to ask everybody who listens to this that they have their part to play and that they can actually make a real difference. I suppose they can do it in a number of different ways. I just think it's important to watch your language. So sometimes people use words, they bandy about words like psycho, schizo, and they can be harmful. They can force people to shut down, be a judge, so they're unwilling to tell their story. So instead of saying those words, say something like a person living with psychosis, and think about, the weather can be. People say the weather's crazy. It's just easier to say if it's all over the place sometimes, and just lose less stigmatizing language. Talk openly and listen to people without judgment, and challenge myths when you hear them. If a friend or a colleague, or you see something in the media that spreads misinformation about psychosis or mental illness, speak up, share the facts, ask questions, and offer a different perspective on things. And because we've all experienced, if we haven't experienced mental illness ourselves, I'm sure we know someone and love someone who's experienced mental illness. It's not that far from any of us these days. And so it's important to share real stories of recovery, and also show your support for the organisations that make change. Charities like Shine are working every day to break stigma, support families, and advocate for better services. If you can share information about their work or join a campaign or lend your voice, it is really helpful. And to anyone who's listened to this podcast who feels they're in the middle of something like this, um, it's important that you know you're not alone, that psychosis is not the end of your story, and there are people who care, who understand, who've been there, who've made it through, and recovery is definitely possible. In my organisation, similar to other organisations, we are here to walk that path with you. My final message is that changing minds starts with everyday actions. And if you need to find out more information about the work we can do, you can find it on shine.ie. But if you need support, you can call us at 01 860 1610, or we have a mobile number 086 040 7701. Thanks.
Okay, thank you very much. And thank you for your time today, Nicola. Really appreciate it. Thank you. You will find this podcast with others soon to be broadcast on mentalhealthreform.ie. Our site also includes a vast repository of policies, research, and up-to-date mental health supports in your area. So please take a look and tell us what you think.